Hi, I'm Dr. James Meschino. If you're a male between the age of 50 and 54, then there's some important health conditions that you have to start guarding against. You've got to protect your prostate gland, we'll talk about that. You've got to preserve your joint cartilage or you're going to end up with arthritic changes. There's a power shortage that's already underway that can lead to congestive heart failure, high blood pressure, some other vascular problems. And also your immune and detoxification systems are starting to become more sluggish as you get older. I'm going to explain how all of that works. So let's start with the prostate story. After age 40, the prostate gland starts to build up more of a dangerous type of testosterone. It's called DHT. DHT tells the prostate cells to divide at a faster rate, so the mass of the prostate increases. That's why 90% of men end up with prostate enlargement problems by the time they're 80 years old. And for most people happens much sooner than that, of course. But when prostate cells are dividing fast, the more serious problem for me is that that's how genetic mutations occur that can lead to prostate cancer. So we know when cells are dividing too fast, there's a greater risk of these more serious diseases. So the good news is that there are natural agents that can block the buildup of DHT in the prostate gland. That's proven. Saw palmetto, Pygeum africanum, beta-cytosterol, stinging nettle, soy isoflavones. I created a formula called Prostate 40 Plus that uses meaningful dosages that have been shown in clinical studies to be effective, that block the buildup of DHT in the prostate gland. It's a vitally important thing for you to do after the age of 40 years old. The other thing that happens at age 40 is that you start ending up with changes that are going to lead to arthritic changes in your joints. Why does it happen? Because you stop making optimal amounts of glucosamine as you get older. And you need glucosamine to maintain your joint cartilage. So studies have shown that if you put glucosamine back in orally, your body can take that glucosamine in place of what it used to make for itself to maintain your joint cartilage. So don't wait for your cartilage to erode and end up with arthritic changes. You need to prevent that as early as possible in the game. And the other thing is that in your joints, as you get older, you're making more inflammatory chemicals that lead to inflammation and stiffness, and pain lingers longer as you get older. So you need to have natural agents that can suppress that inflammatory component, MSM, quercetin, bromelain. So I created a Diva glucosamine joint formula. The glucosamine's already there. With those anti-inflammatory herbs, you start taking it, by the time you're 40 years old, you should be on a product like this to preserve your joint cartilage, because it'll preserve the quality of life that you have going forward. At age 45, the next time bomb goes off. And that was, at age 45, what happened to you is that you stop making optimal amounts of coenzyme Q10. And when that happens, there's a power shortage. That means the cells can't make energy the way they used to. They can't convert food into energy the same way because there's a piston missing in the engine. That piston is called coenzyme Q10. And so there's a power shortage in all your cells, but it really affects your brain, your immune system, and particularly the heart muscle. The heart muscle, even though you don't realize it, starts to get weaker and weaker as you get older. It can lead to high blood pressure and congestive heart failure. Studies show that putting CoQ10 back in as a supplement can actually put that piston back in the engine and maintain the integrity. So you have the power source back in place to maintain the heart pump in a more efficient way. What works best with CoQ10 is an herb called hawthorn. Before we knew anything about CoQ10, doctors used hawthorn for the same reason, to increase energy production, particularly in the heart muscle, to stave off congestive heart failure, high blood pressure, and some other problems. The other thing about hawthorn that's so great is that it opens up blood vessels in the heart, so more blood can flow to the heart muscle. That's one of the ways you reduce your risk of heart disease. And it can also lower blood pressure if it's starting to rise in certain cases. So the combination of CoQ10 with hawthorn is the gold standard after age 45 to maximize energy production and stop the power shortage that otherwise is going to occur. I also put some additional quercetin into Cardio Essentials because it helps to reduce inflammation in the blood vessel wall. So there's a product called Cardio Essentials, a formulation that I have that has the CoQ10 with the hawthorn and also the additional quercetin. Then at age 50, it gets even uglier. Your body's immune system starts to get weaker, and the liver detoxification enzymes become more sluggish. When that happens, you become more prone to infections that can be life-threatening as you get older. And also, the immune cells are important to hunt down cancer cells that are starting to emerge, as well as viruses and bacteria. If you can't do that very well, then you leave yourself wide open to some very serious problems as you get older. So I created a formulation called Immuno Detox Prime that helps to bring the immune system back to a more youthful level of function, and also gives the liver the support it needs to keep the detoxification enzymes working more efficiently so that contaminants and things that can damage your cells don't build up in your bloodstream so easily. It's an important consideration after the age of 50. And so the foundation program for men who are between the age of 50 and 54, you need a prostate support supplement. You're going to need to have glucosamine joint formula to protect your joints. You need cardio essentials to protect your heart. And you also need immuno detox prime to keep the immune system strong and for detoxification systems to be working optimally. And then, of course, throughout all of adult life, you need to be combating free radicals. What do free radicals do? They cause damage to your brain, to your skin, to the cells of your body. They can lead to genetic mutations. To your eyes, leading to cataracts and macular degeneration. So people know that antioxidants can quench those free radicals and slow those processes down. And so I created the Adiva multiple vitamin, and I enriched it with all the antioxidant dosages that you need, as well as the B50 complex and some calcium, some 500 milligrams of calcium, some other bone density nutrients that you also need. So that multiple vitamin is a foundation product, as well as nature's essential oils. It's a combination of essential oils, flaxseed, borage seed, and fish oil, which come together so your cells can make the hormones that reduce inflammation, make your skin smooth and soft, maintain and improve blood flow throughout your entire body to reduce risk of vascular disease. And those oils also slow down the rate of cell division. That's how you slow down aging and reduce the likelihood that cancerous mutations will form. And so between age 50 and 54, the multivitamin, nature's essential oils, prostate 40 plus, glucosamine joint formula, cardio essentials, and immunodetox prime, they are the foundation supplements that you really should be taking. You can learn more about these formulations on the website. I want to thank you so much for listening.